Hello, I'm Melissa, and I will be reviewing my ATI Critical Thinking Assessment in this video. In reviewing my assessment results, I had some mixed feelings. I was honestly a little shocked because I have always thought myself to have pretty strong common sense. So seeing some of these low scores definitely shook my confidence a little bit. However, I was proud that I scored 100% for both explanation and self-regulation, which both showed me that I'm able to clearly communicate my reasoning and reflect on my thinking process. My weakest area was evaluation, in which I scored a super low 50%. This concerned me to see because being a nurse requires exceptional evaluation skills. My two other lowest scores were in inference, which I got 55.6%, and interpretation, in which I got 66.7%. Although disappointed, I can't say I'm completely surprised, just because I know that my biggest hurdle is and always has been that I overthink questions. And sometimes I can rush through reading the questions, which is something I have actively been trying to work and improve on. Clinical judgment and critical thinking are used throughout each step of the nursing process, and I applied this while completing this ATI clinical judgment worksheet. In recognizing cues, I used critical thinking by carefully identifying the most important assessment findings, which in this scenario include patient shortness of breath, oxygen saturation of 88%, crackles in the lungs, and rapid weight gain. This step requires the nurse to focus on relevant data rather than getting distracted by data and findings that are less important. In analyzing cues, I interpreted what those findings meant. I connected the low oxygen saturation, crackles, and weight gain to possible fluid overload. And as my hypothesis, I identified impaired oxygenation from fluid retention related to heart failure. This required me to look at the whole clinical picture rather than just one symptom. Strong clinical thinking here is important because misinterpreting cues could delay necessary interventions. During Generate Solutions, I used clinical judgment to plan appropriate nursing interventions, such as elevating the head of the bed, applying supplemental oxygen, monitoring weight, intake and output, and administering the prescribed diuretic. In Take Actions, critical thinking guided the safe implementation of those interventions, as well as ongoing monitoring of the patient's response. In Evaluate Outcomes, I determined whether the patient improved by reassessing oxygen saturation, respiratory status, and urine output. My lower score in evaluation shows this is an area I need to continue strengthening. If evaluation is not done thoroughly, a nurse could miss signals that a patient is not improving, which could lead to worsening respiratory status or fluid overload in this scenario. Recognizing this gap early allows me to be more intentional about reassessing patients and adjust care as needed. To improve my critical thinking skills, I plan to be very intentional about how I engage with the course material and clinical experiences. One of my biggest goals is to slow down when answering questions so that I don't overthink or rush through important details. I have already noticed that anxiety about wanting to perform well can sometimes cause me to make questions way more complicated than they need to be. I also think seeking instructor feedback and or mentorship from more experienced nurses would help me immensely because I'm still very early on in the program. Guidance and reassurance from knowledgeable instructors will help me build that confidence and accuracy in my clinical reasoning. I also plan to continue actively practicing recognizing and analyzing cues when completing ATI questions, clinical assignments, and while practicing in lab. Before taking the exit critical thinking assessment, my goal is to improve my evaluation skills and demonstrate stronger confidence in interpreting patient responses to interventions. Overall, this assessment helped me better understand both my strengths and my areas with room for improvement as a developing nursing student. One thing I learned is that critical thinking in nursing is not just about having common sense, but about consistently applying a structured clinical judgment process. Strengthening these skills will be essential for my future practice because nurses are constantly assessing, doing interventions, and evaluating patients in order to provide safe and high-quality care. I especially recognize the importance of improving my evaluation skills so that I can accurately determine whether my interventions are effective. I'm committed to continuing to grow in this area throughout my nursing education by actively seeking feedback, engaging deeply with the course material, and practicing clinical reasoning regularly during clinicals and labs. I'm confident that my critical thinking abilities will continue to improve and support safe patient care in my future nursing practice.